Let's talk to Dr Ritesh Maliks, who's the director of Radix Healthcare, a private hospital in New Delhi. He joins us on Skype from there. Many thanks for speaking to us on Al Jazeera and taking the time. Well, let me pick you up on the oxygen point, because the government says it's pulled out all the stops to make that oxygen get to where it needs to go. It's diverted it from the industrial sector and so on, and that things are about to get better. Is that not the case? Do you not feel that things are going to improve?
Not right now. We are very hopeful that the next 72 hours will be better. We have talked to a lot of authorities and they have assured us that they will be providing us with liquid oxygen. You should know this, that we do not need cylindrical oxygen alone. We need liquid oxygen, and large hospitals cannot use cylindrical oxygen alone. We have so many patients on the ventilator. We have so many patients on high flow oxygenation. One patient on ventilator takes 60 liters per minute of oxygen. That translates to 3,600 liters of oxygen per hour. And then if you multiply with the kind of ICU beds that we have, you will understand that the need of oxygen is at a very large scale, in which our healthcare infrastructure is not prepared to give. And we need to, this is an SOS condition. This is something which it cannot be put off till tomorrow. We need oxygen, and we need oxygen right now.
So who is responsible for what has gone wrong here in India, especially the oxygen situation? Because again, on your Twitter page, you describe this lack of oxygen as criminal neglect.
I completely second that thought. I believe that any patient who dies, can you stay or can I stay without oxygen for even a minute? The answer is no. Oxygen is a basic necessity, and especially for a disease like COVID, wherein remdesivir, Fabiflu and other drugs have questionable clinical trials. Oxygen is the only essential medicine. We have something by the government called the Essential Medicines Act. In that, the first medicine is oxygen. And if we do not have oxygen, how do we fight a pulmonary infection like COVID, which is so grievous in nature and so infectious? We are seeing in 3.5 lakh cases a day. Just imagine the kind of situation we are in right now. We have only 16 ICU beds currently available on the tracker for Delhi government. So you can imagine, and currently we are not getting oxygen, and without oxygen, we are going to see so many. See, if a person dies after giving your blood, sweat and tears to help that patient revive from COVID, that is still understandable. But see the agony of the attendants of boys and girls of 27 and 35 years old who are on ventilators and who are not getting oxygen.
Most of your family are working on the front line of COVID. I believe your father is a doctor. Your sister is also working in healthcare. You, of course, talk us through the emotional toll, because we can hear the passion and the distress in your voice.
So it's actually very difficult to describe. When my sister goes into the COVID ward in Pune, it's a small city in India, I feel so scared, and at the same time, I feel so proud. I think we need doctors. We need healthcare professionals. We cannot pay their debt. The kind of service that they're doing right now is incredible. Worldwide, doctors, paramedical staff, of even the housekeeping staff, which is wearing PP kits. Just imagine having would you want your daughter or your loved one to go inside a COVID ward, even in the best protection possible? For most of the people, the answer is no. So we are going through a lot of emotional turmoil. We have not been sleeping well, and our only endeavor right now in Delhi. And the good part which is happening is hospitals have come together. When we had only 10 minutes of oxygen left, we went to the nearest hospital and they gave us a cylinder. So we are seeing such beautiful stories as well in India. And in these times of distress, people are coming together and ensuring that we are really hoping that this crisis is way past us very soon, because we are losing lives everywhere. We are seeing a wait list at the crematorium. People are losing lives unnecessarily. And if you talk about blaming, I think we need to be blamed as well as our government. We did not take a caution. After the first wave went down, we did not follow COVID protocols, and we should now ensure that we follow them. We should now ensure that every Indian should get vaccinated. Vaccine is the only long-term solution. A lot of people are not comfortable with the idea of vaccinating, we are seeing one thing. People who have got vaccinated are getting extremely mild COVID diseases. So vaccination is the only long-term solution.
Dr. Ritesh Maliks, many thanks for taking the time to speak to us on Al Jazeera. Wishing you and your family all the best of luck.
Thank you.